Hey everyone, Sean here. Welcome to another episode of the Dental Up Podcast. Our guest this week is a graduate from Case Western Reserve University School of Dentistry, earning her Doctor of Dental Surgery degree. She also earned an MHA Healthcare Administration degree at the University of Missouri and a BA in Biology at St. Louis University. Practicing from Schofield, Wisconsin, please welcome Dr. Tamara Bailey Pfeiffer DDS. How's it going, Dr. Bailey?
Excellent, excellent.
Oh man, it's so cool. I've known you. We've been knowing each other over 15 years. I think I've been doing your lab work forever, man, and I'm so thankful you came
Forever.
on. That's so cool. Oh man. So thank you for coming on. And hey, I always start off a little bit about sports. I know you kids are all into sports, but what about you into any of that soccer going on, that World Cup, or you hear anything about the whole
Not at all.
Yeah.
I'm horrible. I'm a horrible human being. I don't like soccer at all.
You know what? I'm with you though, man. I look at soccer. They call it football. It ain't football. That's whatever, man.
No,
but
I'm not. I'm sad. Well, hockey, I'm a huge hockey fan. So, between the Stanley Cup and the first rounds of the draft is literally like 3 weeks. So I'm into hockey, probably number one sport. And then baseball would probably be my second one, but it's like a really, really, really distant second.
No kidding. Yeah. I know your boys that play hockey, man. They're just crushing it.
Yes.
But it's all huge around here, man. You wouldn't believe how this place is blown up in LA with LeBron James coming to the Lakers, man. It's like the Laker tickets went from it's so nuts. And they got this guy Cousins, like, as a huge player that he signed with the Golden State Warriors, and it's almost like it's not fair. Like, they got 4 freaking studs, and they already had 3 studs.
Yeah.
They have a great team. I mean, they won 3 out of the last 4 world championships, but now they got DeMarcus Cousins. The dude blew out his Achilles last year, but he's going to be, probably mid-season, but he's like one of the most coveted players out there. And freaking Golden State was able to land. The NBA's got to do something about that. They can't keep stacking one team like that. I mean,
do they have a salary cap in the NBA or no?
Yeah, they do, but it's just so huge now with the TV contracts. It's like, these guys are getting like $40 million a year.
I have a funny LeBron James story for you. I lived in Cleveland before I moved to Wisconsin, and we lived, not far from downtown. And I was in Cleveland when LeBron James graduated from high school and was signed with the Cavaliers. So his very first year. Oh, you're kidding. So I lived in this subdivision, and it was we're talking starter homes, $150,000 starter homes, which I understand in California will buy you a shack, but in this it's 3 bedroom, 2 bath, 2-story little tiny starter home kind of thing. It's $150,000. So anyway, at the back of the subdivision was a player that he had signed the year before with the Cavaliers, and nice guy. So anyway, LeBron James would go down there, and him and this other guy whose name I actually can't remember anymore, and a couple other guys, they would play pickup ball in his driveway.
You're kidding.
And so my kids, my sons would go down there, and they would let the little neighborhood boys play. So my sons actually played pickup ball with LeBron James and his teammate, and he's like, Mom, they're so tall, and they're like, really, they had no idea they were professional basketball players. Like, Mom, they're so good. He's like, they can make it from the street. And I'm like, yeah, I bet they can make it from the street, so so my kids played pickup ball with LeBron James when he first bought a brand new Hummer with his sign bonus, and he would come thumping into the subdivision, and the kids would go play ball with him.
Can you believe that? That's a great story, man. Yeah.
And you know what? My kids don't even remember it because they were so young.
Oh, well, if you ever pass his way in the future, you could always tell him that story. And I guarantee it, because he is actually a pretty humble, down-to-earth guy that, from what I hear, and it's just something. I mean, he was 18 years old when he got signed in the NBA, and he went to Akron, Ohio, somewhere in there. I think a high school over there, but. I've always kind of thought this guy, what a knucklehead. I never really liked him, but the last couple of years I kind of really learned a little bit more about him. And the dude, for 8 years in a row, he's been in the finals, and with 3 teams, different teams. I mean, Cleveland, it was twice, but to go to the dance 8 times, 8 years in a row. You can't teach that, man. That's just whatever team he's on. I mean, he's only won, I think he won 2 in Miami and 1 in Cleveland. So he's won 3 world championships out of going 8 times in a row. I mean, I don't know. I think Wilt Chamberlain might have done it.
He's 30.
Yeah, he's like 32 years left. Oh, I mean, 18 years old in the NBA, and he's like a 15-year vet or something. It's like so crazy.
Yeah.
And
actually, he's not even 30, I don't think.
No, I think he's like 33, actually. I think he just turned 33. But they're saying, yeah, well, you figure 18, 28, 29, 30, 31, 32. Yeah, he's 15 years in the NBA. So,
okay.
But, and he just turned 33. And they're saying, well, that's older, but yet not with him. He's played the most minutes in the NBA last year, more than anyone else. He scored more points, I think, or it was one of the top leaders in points. And, dude's a freaking he's a monster, and you just got to respect him. And then you don't hear about him in the news of being, philandering out, getting all the hoodies.
No, he's really is a decent guy. Yeah. I mean, one of the first things he got was something for his mom. I mean, he's just really, he's a really pretty, a pretty good guy. Yeah. From what it sounds like, as good as you can be in professional sports. I guess I'll say that.
So many people, you give them that platform and that much money, I mean, they're going to be, Johnny Manziel. They're just going to blow it.
Yeah, I'd be an idiot. I'd totally be an idiot with that much money.
I know. I almost am now, but I'm not nowhere near that. But no, I thank the Lord and say, Mama, keep an eye on me because I want to be good.
That's right.
That's so cool. What about your boys now? I remember your boys remind me of like the Wahlbergs, they're just kind of rough and tumble boys that grew up in Dorchester. Your boys were always into havoc.
They are rough and tumble. Yeah, they're kind of, my son just sent me, he's at home. He sent me a picture of, he put the dog on the counter to clean the counters off. And I asked him to clean the kitchen. So he sends me a video of the dog licking the crumbs off the counter. I mean, that's, he's 20. And this is how he cleans the kitchen for me, is he has the dog lick the crumbs. So, yeah.
Hey, my boys do that at 30, man. So they're ahead of the game. That's so cool. Yeah. And then I know you have the 2 boys, and then the youngest, the baby girl. How's she doing? How old is she now? I remember when she was like 2 or 3.
18. Oh, no. Yeah, she's 18.
Oh, that is time flies.
Yeah, so she just finished up high school, graduated with about a bajillion honors. She's got a great scholarship. She's going to be going to college outside of Chicago, and she's going to try and walk on the hockey team. And she decided too late she wanted to play, so the team was kind of full with scholarship players, but they keep spaces open for non-scholarship players. So she's kind of hoping she can walk on. So she's working out every day this summer, and kind of hoping I can watch her play hockey still, because I'm not done with hockey. Unfortunately, my kids are, but I'm not.
Yeah, so I know the feeling. I remember when my boys done
and
football.
Colin's still coaching. Yeah, Colin's coaching, and Andrew's still reffing, and so hopefully Kenna can walk on, and I can drive down to Chicago for a few games.
Oh, how neat is that? Let us know if that happens. We'll get the whole gang. We'll get all the young guns, and
I will.
Yeah, that's just so cool. I remember we all kind of watch our kids grow up on Dentaltown there for a while, just all their accolades and seeing them, and to think now they're your youngest. The best thing about when your kids, I remember I was so happy. Well, my boys were kind of hellions. You wonder where they got it from, but I remember when it was 18, and I'm thinking to myself at night at 1 a.m. when the little bastards weren't in the house. I'm like, where the heck are they? Yeah. I said to myself, they're freaking 18, man. It doesn't matter. They don't call mommy and daddy. They're going to go to jail, right. So not that that's something to be proud of, but I was much more at ease going to bed knowing that, you know what, dude, I ain't going to be called by, whatever. The police are going to be called, and not that ever happened, but that's a weird thing to say.
Well, here's the funny part. My son is the police.
You're kidding.
The one who just put the dog on the counter is a community policeman in the summer, and he's going to the police academy in another year.
Oh, that's so good.
That's the scary part.
Now, for him to even be part of that, he's got to be a good kid, because they really vet those people when they're.
They actually do.
Oh, they do. And I had so many friends that try to be cops, but growing up in Huntington Beach and the way we grew up is like, no. I remember the O'Brien brothers. They wanted so bad to be police. They had so many guns, but then, they were just knuckleheads, and, you can't go and be a cop when you just got so many issues growing up with, this and that and whatnot. But good for you.
Exactly.
I'd love to have, kid. I love policemen, and I think they're underpaid, and I just think, it's a tough job they got. You don't know who you pick up, and when you even a traffic ticket, you don't know how things go, and it's a tough job. Them and teachers, I have a soft spot for both. Those guys are both undervalued and underpaid, and it's just a tough job, but it's so key, with law and order, and then the education of our children. There's nothing more important, I think. It's a pretty important thing, I think, but that's awesome. Okay, well, hey, Dr. Bailey, let's dental up. Okay, so let me start off. Why did you get into dentistry, and at what point did you think, I want to be a dentist?
I already had a bachelor's degree in biology, and I was working in a lab, which I thought, not a dental lab, a medical lab, that I thought, I really want to do some medical research, or I want to work in a clinical lab. And about 2 months into that, it was the most boring, repetitive, stupid job I'd ever had. I hated it. I mean, I liked being a lifeguard better than working in a lab. Yeah. So I was at the dentist, and they said, well, what are you doing? How do you like your job? I said, I hate it. And my dentist is like, well, why? And I told him, he's like, well, have you ever thought of it being a dentist? I'm like, no, all you do is check my teeth. I'd never had any dental work done. And he's like, spend a day with me and see what I do. So I did. And I'm like, yeah, I'm applying to dental school. But my husband at the time was in medical school. So I had to wait for 3 years before I could go to dental school. So I went to graduate school while I was working to put him through medical school. And that's when I got my master's degree. And so then I applied to dental school. Because of that. So, because I hated my life.
That's so good. I mean, you got to be so smart to be able to just, I just think I'll pop into this. I mean, some of us, heck, we couldn't even do the basic algebra, but man, it's like biology. It's like, dude, I just think of cutting frog stomachs open, and I think that was, we did that. Yeah, that was way back. Well, that's so cool. Well, tell me a little bit about, did you enjoy college? How was that? Your dental school part of it? Did you have knucklehead instructors? Tell me a little bit about your journey in the dental school.
I'm one of the few people, I really actually loved dental school. I think part of it was that I had 5 years off between undergrad and dental school, and I worked really hard, and I made no money, and I was poor still, and I was working really hard. So I think, sometimes when you look at it from that approach, like, okay, not being in dental school really sucked. So dental school isn't that bad comparatively. Yep. And, I found some professors that were at least semi-human that I could talk with. And, I literally, I'm not kidding. And I'm not exaggerating. And I started dental school in 1993. So it's not quite the olden days, but it was a little while ago. And I had a professor on the very first day of dental school that told me, just so you know, I do not think that women should be dentists.
Oh, what an idiot.
And I'm like, okay, dude. Well, that's kind of too bad, because I'm going to be one, And he really made my life a living hell for 4 years. No, and then when I graduated, I hear he's leaving the dental school. I'm like, oh my God, that's the greatest thing ever. Where did he get a job? He got a job where I was going to be doing my residency. So I had to deal with him but I'd graduated. So literally the first encounter we had, I told him he was wrong. And he used to always tell me to look it up. Go look it up. Prove to me that you need to look. So I made him go look it up. And because he was wrong, I told him to look it up. And he actually came back and he apologized because he was wrong.
Oh.
And he was fine from that point on. But it was 4 years of living hell from this man.
Can you believe?
It really was.
You never know. It might have been a blessing in disguise, that way he pushed you and stuff. And I don't know. Maybe not. I just sometimes when they do it and push you a little harder, but maybe it wasn't being pushed like that. It was
more frustrating than anything, because I knew I could be a dentist. I knew I could handle dental school. I knew I'd be a good dentist. So it wasn't that, but I mean, there was a few girls that he completely broke. I mean, they were crying and, you know, and maybe that was his method, but he didn't do it to the guys. But it was frustrating because, you know, my lab work would get thrown in the trash, and he would say it was ugly and it was horrible and I had no skills and, you know, all this stuff. And it was frustrating because I'd have to do it over again. And somebody would take my stuff out of the trash and turn it in, and they were horrible, but they turned my stuff in and got an A, and I had to redo it. You know, so that kind of stuff got a little old after a while. I
would have kicked the guy in the nuts, but that's me. You know, that's why I never. Forgive me, but I can't handle that stuff. That's kind of crazy.
Yeah, it was stupid, but whatever.
Well, I can imagine you and confronting with him and talking about things, and I know you can hold your own with the best of any male, female, anyone out there. 'Cause I know you, Tammy, and you just you got it, girl. All right. All right. Well, tell me now, did you start out as an associate or did you purchase a practice? Tell me a little bit about how you started off when you first started.
I started out, I did a residency. And then when I started out, we were still in Cleveland, and I was married. Like I said, I was married at the time. And my husband still had another year left. He was a chief resident, so he still had another year. So I kind of found a corporate type job in one of those chain types. And it was a local chain. And it was worse than dental school. It was horrible. I hated it. I had to give 90 days notice. I gave 90 days notice on my second week. So I worked there for 90 days and 14 days. So it was horrible. So I had to put 4 months in there before I could get out. And then I did a few associateships, and the longest one lasted 4 months. And they either didn't give me work to do, or I was doing cleanings, or I would sit there all day and just check hygiene because they didn't schedule any work with me because they didn't talk me up that I was any good. And then the one lady never paid me. I mean, it was like just ridiculous. And I'm like, F that. Yep. I'm going to start my own practice. So I'm 7 months pregnant with my third child. Yeah. I've got an 18-month-old and a 3-year-old at home. And I started my own practice. I found an ad in the paper.
Yeah, I remember it way back. Yeah. Go ahead.
That was the one. I found an ad in the paper, and it said dental office for rent, equipment included. I'm like, what is this? So I called it up, and they're like, he really wants to retire. He's like 75 years old. His wife passed away. He doesn't really know what else to do, but he doesn't want to leave these patients in a lurch. And this was in the Wednesday paper. I met him on Thursday. I wrote up a little contract on my computer on Friday. We shook hands over the weekend. He retired on Monday, and on Wednesday I went in and started painting the office. Like, it was literally, he sold me his practice for $2,500.
Oh, and dang, that's cool.
I had 3 babies, and he let me make $500 payments because I didn't have any money. Yeah. So I made 5 payments. I gave him $500 down, and then the next 4 months I made a payment of $500 for my practice. And he had about 300 patients and stuff. And he had some mostly hand instruments. The equipment was pretty old, but it was worth $2,500 totally. So it was like the greatest deal ever. And then when I sold that practice, I sold it to someone for a really good price as well. I sort of was like paying it forward. It was a little more than $2,500. I'm not going to lie, but I sold it for enough to pay off my loans that I had left, because I was only there about 4 years, to pay off my loans there, and then to start a little something here. So it was, I kind of somebody in, karma wise, just to kind of pay it forward a little bit. So
absolutely.
Yeah. Same kind of thing.
That's unbelievable.
Yeah. Kind of a handshake, write something up. I sold it to one of my professors at the dental school that wanted to do something part-time. And I sold it to him for $50,000, and it was a deal for both of us. I'm like, perfect. So cool. I'll take it.
That's so awesome. I had a buddy that he bought one back in the day from an old timer, but he paid $10,000, and he made payments on that for, I think it was a couple years even, but that just, you look at these young kids, I don't know if a mommy or daddy got all the money or what, but they're paying so much money, and they got so much debt. And it takes big wables to start out now. Well, in any era, of our time, it's always a gamble and tough, but to have, $400,000 or $500,000 and, and student debt, and then to go get $1 million practice. And it's like, dude, how you without even getting in the trenches, but some of these guys, I don't know how they do it, man. And it's just my hat's off to them that do. But I like it when I hear stories like yours that kind of self-made and made it happen, and it just, and I know how tough it was with your children and all that. And then your husband, I mean, you support him all through medical school.
Yep.
The knucklehead.
Yep, exactly.
But we won't get into that.
Yep.
But, so tell me on your practice now. Tell me a little bit about the layout. How is it, and how many people you got going? And tell me a little bit about the spread on your.
We have 10 ops, and there's 2 docs. So we have 2 docs and 4 hygiene. Each of us work out of 3 rooms.
Okay.
It's a good practice. It's a really good sized practice. I'm busy as hell. I run 3 chairs. I run 3 chairs all day. I work 2 long days and 2 shorter days. So I work 7 a.m. to 6 p.m. on Mondays and Wednesdays. Dang. And I work 7 to 3 on Tuesday and 7 to 1 on Thursday. So at 1 o'clock on Thursday, I'm out of there for the weekend. Cool. The long days suck, but they don't. I mean, like, they're good and they're bad because we work hard. I mean, I am cranking out of 3 chairs all day long. Yeah. And, I block schedule, which helps. But I do a lot of same day treatment. So I get a lot of emergencies in. And so I'll schedule, 2 hours for an emergency, and I'll do same day treatment, and we'll just roll it into the day. I kind of like that. I don't like to plan it. I don't look at the schedule for the next day. I trust that my assistants have gotten it right. And I come in the morning, I'm like, where do I go? So I kind of like that little bit of, little bit of adventure. They know what I need. So they get it scheduled, and that's, I just kind of go from there.
That's so cool. What about on some of the procedures? What do you like doing? What do you not like doing? What do you send out?
I like crown and bridge. I hate fillings. I used to love fillings, and now I just hate them. I think it's because I liked them when I could just sit there and do those, and I didn't have 2 other people waiting on me and 4 hygienists waiting on me and the front desk asking me questions. And, I could just get in there and do my thing, and I really liked them. Mm-hmm. I don't mind doing them. I just mind having other things I need to do at the same time. So I guess that's kind of but I do a little bit of everything. I'm really loving ortho. Really? If I had another chair, I would devote 1 chair full time every day to ortho. Really? If I had another seat to put a butt in, that is literally what I would do. So,
on your ortho,
I've really gotten into it.
On your ortho, you doing like DePaul's Power Procs? Are you doing the 6 month? Are you doing Invisalign? What kind of ortho are you doing? Are you doing old school or?
I do Invisalign and DePaul's. I mean, I do the bracketing, and I learned it from Rick. And okay. I've taken I did some Brock Rondo, and I've done several ortho classes. So I do full mouth ortho, and I do a lot of Invisalign as well. So those are my main 2.
Invisalign bitching how you just freaking scan the mouth and you get these mouth guards and they freaking just kind of adjust it slowly, and it's kind of amazing. And I just see the newer.
It really is.
Yeah, that's a trip.
It's come a long way.
Yeah.
It was, I was not impressed with it 6-7 years ago, but the amount of compliance that we get from the patients is so much better than them trying to brush around brackets. I just find it, I find it really, really pretty good. I'm getting some decent results. Obviously everybody isn't a case, for Invisalign, but I put them in traditional. So, but I actually really like Invisalign, and I like scanning them and throwing them. It's great.
That's a trip. Are you scanning any other, do you have any, tell me about your scanning capabilities. Do you have like a CEREC, or what are you doing to scan?
I have an iTero. Yeah, we have an iTero. If it's with the Invisalign, we do a lot of scanning and we'll do Invisalign stimulation on folks too. Like I did one yesterday where, she wasn't 100% sure. She wanted to take the tooth out that I was kind of recommending we extract in order to, to make her ortho work a little bit better. And so we scanned her with it. And, I showed her with the tooth in and with the tooth out, kind of, I kind of explained to her what the differences were, but she could kind of see it while I was talking about it. So just for that right there, I mean, one ortho case is going to pay your bill on the scanner for a couple months.
Oh, absolutely.
And it was just because she could see it. Yeah. It was just because she could see it. And sometimes when we're doing a cosmetic case and it's not going to be ortho, we'll scan their teeth so that I can just point on the screen to their teeth. Yeah. It's a lot easier to kind of for them to visualize. And the intraoral camera, it just never worked for me. I've never found that works for me, and it doesn't, I don't know, they just don't see it. It's good for an individual tooth, but like you're showing them photos and, you know, on the fly. Now, obviously I can prep something ahead of time, but that's not really my patient pool.
No. And it's just,
my patient pool is, they come in with their tooth in their hand, like, this fell out last week. Like, should I pull the one next to it? Or, you know, that's who I got coming in.
I know, but I tell you, when you're sitting there and you tilt your head over and it's an iTero or it's a, you know, True Def or whatever it is, but for the dentist to just show that mouth ears in a 3D angle and it kind of twirls around and to show them what the past possibilities are. And it's just so 21st, 22nd century, man. It's just, it's amazing. And like, sure, the intraoral camera was great to show cracked amalgams, this and that. Look at you do, but to do and show them on these, you know, monitors with the 3D shaping and everything, it's so amazing. And that's so awesome.
It really is. It's like, kind of like, I always tell them, like, when I send it, you know, I hit send. I'm like, all right. I said, remember that part in Willy Wonka and the Chocolate Factory when the little candy bar guy is like going in the air over to the other one? I said, this is what it's doing right now. And they all look at me because like that's what they're thinking of too. Like it's in the air. Like it's some, you know,
dude, I tell you,
it's being teleported.
I have dreams of that because we get it from you and so many iTero scans and on the interweb, it just comes through. And I always think of Willy Wonka where that everlasting gobstopper comes through, and it's like me. I'm like Shawnee Wonka and the Tooth Factory, and I'm sitting there with my hat,
there you go.
and I'm watching this, and it's like, and I got all these little people in my lab just working away, and it's so freaking crazy. And I swear, I got my boys. They photoshopped me with like a Willy Wonka hat, and I got my fat face, you know, my nose, and my hair is all flipped out, and I look like Gene Wilder. I look like a freaking mess. And it's like Shawnee Wonka. And dude, and it's getting that way. It's so crazy. I'm so excited here. I got these dudes from Silicon Valley in here, and they're a total software company, but they're into the 3D printers. They're called Carbon, and it's kind of the newest. Oh yeah, Carbon, man. Carbon is the shit. It's just so freaking awesome. And
I have heard some really amazing things about Carbon.
Oh, and you're gonna love it because we can make our models instantly now, and we're making them left and right. And I got a few more of these Carbons coming, but it's taken them over 2 days to set this up, and we had to go through all these hoops and to get the room all clean. You know, it's got to be a total clean room. And just on and all the electronics and, you know, vacuum systems. But man, we could do hundreds of models a day now, and they're so freaking accurate. I mean, these are for implants, these are for everything. So we're so excited that it's in-house now, where the only thing we ever outsource is our models, because I've been burnt so much. I've got 3D printers that probably $300,000 or $400,000 in 3D printers that are obsolete now, that I can't even get $3,000 for them in the weight of the metal and the 3D systems and on and on. And
oh, geez.
So it's just, but that's been the way from the beginning with my cat.
You should sell them to dentists that are wanting to make their own aligners, because that's like, can they make that? Because people will totally buy that.
But it's like, you need like a $10,000 freaking service contract each year. And then the materials, the cost, it's so old. It's like an old computer. It's just so outdated that even a dentist wouldn't buy it. And dentists are so frugal as it is. They're not going to, buy this. They're like, hell no, Sean. Charge me $20. I'll take my model. But it's just amazing how they have changed and evolved. And, you know, now this is a platform where you basically lease it. You know, it's a lease. So, you know, in 2 years I can back out of it and whatever, or I can just get their newest one and it comes right in. And because at the end of the day, and all these products that I buy, they're not really worth anything at the end of the lease and or the, you know, just the time we have it, everything's new. And so this is kind of the business model I think I understand it, and I think it'll work better for me. Plus, I'm going to depreciate it and write the shit off like you wouldn't believe. And
you betcha. Well, and that's. I mean, you have to, in order for you to stay competitive. I mean, like, I only need to be as fancy as my patients. You know, I mean, the equipment I'm working on is older than my assistant. So, I mean, but they don't, as long as it's clean, my patients don't necessarily know that the chair is 25 years old. But we're getting new equipment, by the way. But I mean, you have to stay so much more up on the technology to stay competitive, because if the next guy can deliver the product that fits better and is 3 days faster, you have to stay up on that so much more than I do. And that would suck. I'd hate. Yeah. I'm like, I'm turning into one of those old curmudgeon guys at my dental school, like amalgam is the best. And I'm like, fuck that. Can I say that?
Yeah, you can say whatever you want, man.
I just dropped the F-bomb. You can beat me out. Okay, sorry.
F it. No, don't worry. Hey, this is my show. We don't have any Spear ain't sponsoring this one. No.
Good, because if you did, you just lost him because I dropped the F-bomb.
Frank, it's been nice working with you, but F it. No. Nah, I'm the judge, jury, and executioner here, baby. You can do whatever you want, man.
Perfect.
Nah, that's so cool,
but
man.
Yeah, I just, I like the technology. I like the scanner. I like this, but like, do I want to spend my nights and weekends learning how to operate a 3D printer? No, because you know what? You have the best one. I'm going to have you do it because I don't want to do it.
Exactly.
So I don't want to learn. I want to know enough about it to know if I'm getting a good product and to know what to ask for. But other than that, I got nights and weekends. I want to do something else.
Absolutely.
Like last night, The Bachelorette was on. That was very important that I watched that.
You watch that?
No, it was on TV and I couldn't find the remote because I think one of the dogs ran off with it. So I watched The Bachelorette because I couldn't change the channel.
Oh man. Are there any hot guys in The Bachelorette? I've never watched that show. It's all dudes and one girl?
I don't know. I was just like, I almost stared at it with my mouth open because it was like, these guys are fighting like middle school girls. And I was like, what the hell? They're whining. And then I don't even know any of their names. And this one guy had like long hair and I don't know. It was like that. It was like so weird. It was like I'd been transported to another country. I probably will not be watching that again. Exactly.
Where's my beer drinking, shot swilling
give me some fat old bald guy. He's not going to leave me.
Exactly. Treat you like a queen that you are.
He's got a good thing.
Yeah. That's what my wife says. She goes, "Oh, Sean, I'm the same height, but I put on a little bit of weight, and she's the same, but she loves me for who I am."
That's right.
Well, tell me a little bit about, because you guys are crushing it, definitely at your practice. Thank you for all the work, and it's been crushing. But what has been your marketing strategy? Do mailers, social media? You working in the public sector? Tell me a little bit about how you're driving patients to your practice.
We really, we've done mailers in the past, and that seems to be. I'm affiliated with Heartland, so we do these mailers, and some people bring them in. Yep. I'm not going to lie. It mostly is. It's really effective for emergencies. I'm not going to lie. We get a lot of emergency patients from the mailer, because we can get them in within a couple days, depending on the level of their emergency. Sometimes we'll see them same day, and then it's our job to win them over once they walk in the door. Yep. So a lot of them become permanent patients. So, people kind of poo-poo the mailers and that kind of stuff. Yeah. But, we get those patients in the door, and from the second they get on the phone, my staff is so well trained to take just excellent care of them. And, we get them in, we explain everything to them, we get them that same day. And then our next that we're really is we ask for referrals from the patients, and we've got it actually. We started out, we were down around 10% of our referrals came from existing patients. And we are up to over 50% of our referrals are coming from existing patients.
Yeah, that's huge.
And that's been a real concerted effort over the last year to ask for referrals. And, people, they see our busy practice and they just assume we're not taking new patients because they come in and the parking lot's full.
Yeah.
And, so they just incorrectly assume. So once we started asking, the number of people that were like, "Oh, you're taking new patients? Oh my gosh, yes. 3 of my friends are asking, and I just assumed you were full." Okay. I'm like, "No, we are not full." So that has been really huge. We're not huge on the social media because with the way Heartland operates, it's really tough to use some of those platforms from our equipment at the office because we're so like locked down on what we have access to in terms of. I sound like I'm talking about North Korea, but we're it's to prevent breaches.
Yep. No.
It's to prevent breaches. I don't even remember the number of attempted breaches that have happened every day on Heartland Systems. Yep. I'm not kidding. It's some weird number like 10,000. I mean, it's like ridiculous daily.
So crazy.
It's
unbelievable.
They don't want us, accessing some of the social media because if we access the authorized stuff, it's not a big deal. We can do that. But, so it's sometimes a little difficult to sort of, I think that's where we're venturing, is starting to do a little bit more social media.
Yeah.
But, I have a lot of rural folks and farmers. They don't have internet service, so they're not going to find me on Instagram.
Exactly.
Well,
I know.
They're gonna come in and they're gonna kick the cow shit off their boots, and then they're gonna sit in my chair. How'd you hear about me? Oh, it's so and so down at the feed store. He told me about you. Yeah, and I'm like, okay, let's go.
I love that Fargo accent, man.
Yeah, exactly.
Oh, I heard about you over at the cow store now. That's so cool.
Yeah, at the Fleet Farm, the farm in Fleet. I got you. Yeah.
At the auction. What about Rick Is Rick Workman still the dude at Headland? He's still the head guy, or remember Rick Workman?
He's the head guy. Well, he's not the CEO anymore. He's kind of like the president, owner, whatever. I mean, he's still involved daily.
Okay.
Yeah, and then Pat Bauer is the actual CEO.
Okay.
So Rick and Pat are kind of at the helm, but say what you want about corporate dentistry. I've been super happy. I run my practice. I've never gotten a call from anybody telling me anything what to do.
Yep.
I work my ass off, and then the difference is when I need something, I call and it happens. So,
yeah.
I was ready, and, I'm a profitable practice because that's the way I run my business.
Yeah.
And my partner and I decide what to spend our money on. And we decide, when we need a new employee, and we decide, that kind of stuff. But then I just call up and go, hey, I need a new employee. Yep. They put an ad in the paper. They screen them for me. When we get screened, then they go to my office manager. I only see them when they come in for a working interview, and that's when I have to deal with them. It's that kind of stuff.
And that's for a lot of dentists. They would love it. I mean, because a lot of guys don't have the structure and just their systems in place. Yeah. And that's kind of why you guys are rock and rolling. And it's not about, so many dentists want to do every aspect, and they're only giving, 30, 40% effort on each one, where be 100%,
exactly.
In your practice doing what you do. And that's working on the patients and that, and let everything else fall into place. And I remember back in the day, way back, one of the earlier meetings at Dental Time, remember we're outside, and I remember Rick Workman was there. We just met him, and there's freaking somebody blowing a doobie in the background, and he's looking around. I remember going, oh God, that's not me. I'm just the lab tech. But he was so chilled about it. And I remember at the time I was talking to him, and he had 160 practices back then. And I'm sure that's a lot more than they got now. But he was just he kind of reminded me of like a movie star type dude. He just had the good looks and just kind of remind you of like a McQueen.
He does.
Type,
I mean, he's very charismatic, and he's there's over 800, and I think there's 800 and something now. 850.
Can you believe it? It was 160 back then. I'm thinking, dude, I got 1,000 dental practices, but I'm thinking to myself, but I didn't say that to him because I was just kind of in awe. And like you said, he's kind of eccentric a little bit, but he really, for me, just being a lowly lab tech, but I was with all the dentists. I was with you and Clayton and Scotty Bridges, and and we just kind of shut up and listened to this guy, and he's like the Pied Piper, and it was kind of a neat thing. But some of the guys with their practices, I don't want that. But for some people, it works, and they're not at 800 practices right now because of luck. They made it happen, and it's helped a lot of dentists practice what they want to do and let them do what they don't want to do, and it works.
Exactly.
So hats off to you, man, on that, man. That's
well. And when I joined them, they really do. They have a bad rap, and it's from people that don't know.
Yeah.
It really. I mean, now there's always people that are going to be unhappy, and they're going to leave because they're unhappy. But the only way to be unhappy at a Heartland dental practice is to not do anything.
Yeah.
If you're gonna, I didn't have to change the way I practiced dentistry when I moved from private practice to that. Literally, all I had to do was learn the names of the employees at the practice I joined, because I presented the cases the same way. My communications were the same way. The things that I've changed are things that I've actually improved in terms of, I used to have the financial discussions with the patient. I don't do that anymore. I have much more qualified people that can do that kind of stuff. I say, you know what? I don't even know how much a crown costs in my office. And I truly don't, because there's 472 different insurance plans I take.
Yep.
So I said, I'm going to have you talk to the professional in my office that handles this all day. I'm just here to take care of the teeth and to take care of you. And I move on. So, you know, it's a great way. And this is the way I practiced, you know, a lot of the stuff is the same way I practiced before. So it's not a shift in thinking in terms of how I practice dentistry. I'm still taking the same care of the same patients. And 40% of my old practice has come with me because I had to leave it behind to get away from where I was. And 40% of my practice has found me and followed me because they like the way I did dentistry, and it's the same. It hasn't changed. Just the names of the players that I surround myself with have changed slightly. So it's not a bad gig, and it's, you know, there's a lot of really, really, really happy people that work for Heartland. I'll tell you that.
I bet
there's more happy than unhappy.
Well, you just got to buy into it, and it's just it works for people that want to engage in having somebody run it. You know, doing the things they don't want to do, like the accounting and the billing, all that stuff. I mean, I think it's huge.
I don't want to do that. I don't want to do the IT. I want to call somebody when I need my IT fixed.
Exactly. So do I, but I know that's what I got.
Yeah, exactly.
Yeah. But tell me, what about is Dr. Gabri still with them? Seth Gabri, remember him?
He is. Yep.
Yeah,
yep,
I remember.
He is. He does a lot of clinical. I'm not actually sure how often. I know he practices. It's not full time. Okay. But I know he still does do some clinical. But he's like one of the senior, I don't know all the titles in Heartland because I'm not like a big name person. I know his name, but I don't know exactly what he does. It has to do with, he does a lot of the clinical supplies and mostly the clinical stuff. So supply testing and you know, because we have preferred vendors and preferred supplies and blah, blah, blah.
Yeah. Oh, yeah.
And so he does a lot of that kind of stuff. And
he's the man. You know, I love Seth. He's a good guy. I always bust his balls like, dude, come on now, because you know you got certain labs you can't use. You're pricing this and that, and I kind of always was. When I see him out at the conventions. Come on now, Seth, because I used to do his work forever, but he kind of dropped down, and I think he's doing more for the corporation than actually practicing dentistry.
I think he is. He might. I mean, he may be practicing once a week. I'm not sure.
Yeah, but I was kind of Seth. Come on now, but no, he's a good guy, and that's awesome to hear, man. Love that for sure. So tell me, what are you doing for CE? I know we've done a ton in the past. I remember in Chicago midwinter, we'd always meet up at I do a party at Ditka's restaurant, man. And because I made his teeth, and I always say that to everybody, I made his teeth twice. And so we'd rent out the top hall. And I remember one year you guys had a group called the Young Guns, and it was basically Scott Bridges, Frank Clayton, Brenton Young, and Tamara Bailey, the three guys and you. And you guys used to lecture all over. You used to do a lot of stuff. But I remember, what was the hats where you guys had the hats and the fez, or what was the name of that? The Shiners.
Oh, God.
We
had like those the fez caps. And I don't even remember. I don't even remember.
Just messing around, but y'all dressed up like Shriners. We went off that night. We all had
hats, and we decided we were going to have this meeting. And I mean, it was really all a joke. And then a bunch of us put it in our, remember Tom Shane? He put it in his newspaper that he had attended this big meeting, and it was all made up. All we did was drink.
Yeah. We did fake news back then. No.
I have a confession to make, though. I've actually never attended a CE class at Chicago Midwinter.
Either have I.
I've actually never registered for the meeting. One of you guys always lets me in with a name tag.
Yeah, we'd get you a name tag. Keating Dental Arts. She's our clinical director, Dr. Bailey.
So I've actually never. I definitely don't do my CE in Chicago because I usually just go there to socialize.
Yeah.
But I will tell you what is that Heartland has one of the top CEs. That is such a huge priority of theirs that, we have sort of some excellence in dentistry type continuums, and we have some cosmetic continuums. And then I've been actually, they have a huge mentoring program within Heartland. And so once you get to the level where you can mentor new docs, then you can attend a sort of a program on how to teach and how to mentor and, keep up on stuff. And so I went through that last year. And so now I mentor. So if we've got somebody, because we get a lot of new grads, and so if I get somebody that's having difficulty with leadership or with clinical situations or whatever it may be, we will sort of gather them into our arms and help them, so I'll go to an office and I'll help them with scheduling, or I'll help them with training their staff, or I will help them with clinical techniques on, say, if somebody needs to get a root canal down from 3 hours to 1 hour, I'll get them, we'll kind of go through that. So I think that mentoring is huge because it's hands-on, one-on-one. So I do a lot of that. I take a lot of CE through Heartland. And then I always look outside for other CE as well. And I enjoy taking it. Now that my kids are older, I've got a lot more time available to kind of do that stuff. I was actually just taking a little online sleep apnea thing this afternoon. I was just kind of reading it over lunch. It'll probably take me 2 weeks to get through it. But 20 minutes here, 20 minutes there. I do a little module each day at lunch just to kind of, I like to still keep up on things and, try and provide the best for my patients. So I would say about 80% of my CE is taken through Heartland. Okay. And then the other 20% is online and or hands-on. I try and find stuff locally, but there's not a big call for CE in Wausau, Wisconsin. So.
Oh, no, that's awesome.
None of the big guys have come to town.
I could see you, though, being one of the head mentors, because you could do it all. You've been through it all, and just you're so strong in your personality, and you just can get along with anybody. But I could see you, as it winds down, maybe I could see you really going out there and just really rocking and rolling with a lot of people.
I would love that. I mean, I think that would be right up my alley because it would keep me in it.
Yep.
But also it would just, and I do like to talk one-on-one to people, to do that kind of thing and kind of pass it along. I can be a little out there for some people. So I sometimes tend to bowl a really, really meek person. Maybe they wouldn't assign me to.
Yeah, exactly.
Because I'd be like, what the fuck? I would just be like, what is wrong with you?
Yeah, pick it up. Pick it up, old timer. We got to get this.
I got to rein it in a little bit.
Yeah.
This isn't dental school, you moron. Yeah. No, I'm just kidding.
Now, come on, put your big boy pants on and let's get this tooth isolated.
Let's go.
Here, let me show you. Sit down in the chair and, monkey see, monkey do. Watch this. That's awesome.
Exactly.
So what is some of the advice you can give some of the newer dentists out there starting off? And I know you've seen it all from starting your own practice and everything else. What kind of advice for some of the newer ones coming up and what the do's and don'ts?
This is kind of funny because my advice is not going to be clinical. I think 10 years ago it would have been clinical, like get really good at root canals or get really good at extractions, which, those are things, don't go outside your comfort zone too far until you really get good at something. But the best way to do something is to just do it over and over. So, say if somebody wants their tooth out, say, you know what? I've been trying to get better at endo. Let me get you a deal here for the cost of that extraction. I'm going to do a root canal on that tooth. And, I'm going to do it. And I just, I want to get better at root canals. And you know what, if I do a good job, not obviously present it a little bit differently than that, but I want to get faster, whatever I want. I've got some new equipment I want to try out, whatever your spiel is, I've got some new equipment I want to get more efficient at. And since we're going to take that tooth out anyway, obviously if it's a savable tooth, let me do the root canal so that I can get a little bit better with my equipment that I'm testing or whatever your story is.
Yeah.
And then it's a win-win. I get to be better, and you get a root canal for $175.
Exactly.
Those kinds of things you cannot buy that kind of education. Yep. The patient knows they're going to be thrilled with a $175 root canal. Yeah. Even if it takes them 2.5 hours, you've now got another molar endo under your belt.
Exactly.
Those kinds of things you can't be afraid to think outside the box. But one of my biggest things that I would say is that you've got to develop yourself as the leader of the practice. Okay. It can't be, You can't take your advice from your assistant. You can take information from your assistant, but you need to be the leader. And I'm not saying the dictator. You need to lead by example. So you need to be not an hour late to work like I was this morning. You need to, you need to be on time. You need to be true to your word. You need to treat all patients with honesty and integrity, and you need to treat all patients equally. Those are all things that I think people don't worry about, and they think that stuff will kind of come along down the road. But the biggest thing you can be is to be a leader to yourself and to your family. This works on kids too.
Yeah, absolutely.
I can't lie to somebody and then expect my kids to tell me the truth. Yeah. It works, it works with staff. It works with patients. It works, it works just in your personal life in general. You'll just be a better person overall. And if you can be a good leader, the rest of it will kind of come along, because your patients, your staff is going to love you. Yes. Your patients are going to love you because your staff loves you. Your kids are going to love you because you're not an a-hole all the time. Yep. There's a lot of stuff that can come along with that. But just, I think, doing that and thinking outside the box clinically, nobody comes out of dental school knowing how to do shit. Yeah, exactly. So just to say, you know what? I'm learning how to place implants. So for the next 10 patients, which is exactly what I did, I placed implants before. I said, but my staff hasn't placed implants before. Yeah. I said, so there's going to be times when we don't get it to the lab on time, or we write the wrong instructions and it's going to take another week to get it back. Or, Dr. Bailey forgets to write down that it's a porcelain fused to metal screw retained crown, like I just did on my case to you. So I said, we're going to, now we're 150 implants in. I may be just a moron, but
you're doing great, baby.
By taking that time to, explain to the patient, we are learning together. And my staff and I are learning together. The patients appreciate that. They appreciate the discount. We got to do 20 implants in our first month because I did them all for half price. Yeah, exactly. And by the end of our first month, we were ready to go. I mean, we knew we paid the first 6 months worth of our payments on the CT, and we were, we paid for the implant kit and we were ready to go. So we were prepared. So then, anytime a 3-unit bridge is on the menu, my staff feels comfortable offering an implant and talking to the patient about implants. Awesome. The front desk knows how to explain financials because they did it 20 times in 1 month or 30 times in 1 month to explain it. So, you kind of, just treat your practice as a learning experience as well. Yeah,
absolutely. No, that's words of wisdom there, baby. And that is really so on the money. And almost Howard Friend does that a little bit, and getting people in the chair, like cutting his, 6 through 11. He gives you 4 to 13 for, the same price, but he knocks off 50% of it. And, for $49.95, he goes, hey, it's a couple hours. It's extra half an hour to get those premolars done. And it's another $200 from the lab, or $300. But I got the chair filled, every day instead of 2 a month, but at the end of the day, you can do what you want. You're in a way to get it started and get the word out and get your chops, sharpened. Right. And it's just so cool. What about, we'll wrap this up, but just great advice today, Dr. Bailey. We really appreciate it. But what about with the tough patients in the chair? You're part psychologist, you're part, team leader, coach, everything. What do you do with tough patients? Small mouth, big tongue, or just disgruntled people? How do you handle them? And because I know how you know how to handle people, but what kind of advice can you give some of the newer people starting off on dealing with patients that are less than, perfect?
The physical stuff it just sucks. I mean, there's no way to get around it. I've got a gal right now that we're dealing with. When she opens her mouth, her lip bleeds, and it doesn't just drip, it drips. It was running down her neck. We're having a hard time. I may not restore her implant in the back because I don't know that we can get the instruments in there. Yeah. So that one's just do the best you can with what you got. But the disgruntled patients, that is like my challenge. I mean, 99.9% of those people are disgruntled because they've been treated poorly in the past. Okay. He comes in as an a-hole. He gets treated like an a-hole. That's not how you do it. No. If he comes in and he's barking at the staff, I'm going to say to him, listen, John, I appreciate the fact that maybe you've had some tough times in the past with dentists or with offices. And I'm going to set you straight right now. We don't operate that way. That's not how I operate that way. So, I'd appreciate it if you just, dial it back a little bit for the staff, because it really upsets them. And then when they're upset, they tend to make mistakes. And then, you know what? They've just proved you right, that this place is a goofball place. Yeah. So, I've only had to do that a couple times, because most times when I go in and talk to the patient, I say, you know what, I said, we're going to do everything honestly. I'm going to honestly tell you right now, if I try and restore that tooth, it's going to be a cluster. It's not going to go well. Yep. But you know what, if you invest your money on this other side, or we talk about this, or we talk about an implant, or we talk about a partial, you're going to have your money is going to be much more well invested. It's going to have a much better chance of success. And I guarantee you're going to have a better experience. I feel like a lot of those people are just the way they are because people aren't honest with them, or people don't take them seriously, or people don't treat them. I don't care who people are. I don't care what they do for a living. I don't care how much money they have. I treat everybody the same. And I really, really, really think that comes through when I talk to people. I really feel like they see that. And I can, some of those old guys, you can't turn them around for nothing, but they'll at least come to their appointments on time. They'll behave, and they'll go home, and they'll be crabby again. Yeah, but exactly. Some of these guys, they turn around and they end up being really nice guys. Yeah. They just have never had anybody take good care of them. Yep. And, so that's really my advice, is just be nice to people. Yeah. That could go a long way, really, everywhere. Just freaking be nice.
Hey, I've said that before, man. 2 words in life, just be nice. And, it's kind of the golden rule, treat people how you want to be treated. But it goes so far, especially when you get see, as I get older, I get, like you're saying, I try to do the little reverse psychology on it. It's like, this guy's, a fireball. I'm going to get right back in his face, and I could be 10 times more than you, dude. But no, I flip it, and I just, kill them with kindness and just agree with them. And 5 minutes later, they would, they'd pick me up in Antarctica. It just, you can really get to people by treat them good, touch their heart, and really try to, let them know that, you're here to help them. And just be nice, and it'll come back to you. Yep. And if it doesn't, it's their loss, and you tried.
Down. I mean, I'm not going to do anything. I'm not going to back down. They're not going to bully me for sure. Yeah. Because some of them come in here and try and bully you. I'm not going to let that happen. Yep. But I think, some of those guys really freaking appreciate that. Oh, yeah. Is that you don't let them bully you. Exactly. That's their way of getting around, and it's not going to work. So, that's the best way to be.
Oh, I agree totally. And, the bully thing, the number one thing a bully doesn't, when they hear you get back in their face, they kind of shut up and they go, oh, okay, I can't push this person, but that's the way it is. Yeah. And, and I've got employees sometimes, they're going to tell me how it is. And, I got to listen to that. And I like it. I say, I like your moxie, I like you, speaking your mind. Now, all right, now get back to work. No. That's just, I think that's awesome. Words of wisdom, Dr. Bailey, man. I can't thank you enough, man. This was a fun podcast. I kind of shut up, and probably people enjoy, like it. Well, Sean's not blabbering, and we got a doctor talking mostly, giving us good advice. So good job, Dr. Bailey. So
I'll just talk over you. It doesn't matter if you're talking, Sean. I'll talk when I want to. No,
hey, I love you, man. I always have, and thank you for all the work. You got any plans for tomorrow? Tomorrow's 4th of July, baby. You gonna go?
I'm actually remodeling a house. No so kidding. I've got some trim I got to tear down. I've got some siding to put up. I've got some flooring to install. I'm going to try and install the bathroom as well. So we'll see.
Oh man.
Those are my big plans. We'll see if any of that gets done.
I tell you, you are like MacGyver. I mean, you do everything and you can do anything, and you're just a strong woman. And man, I respect you, love you, and God bless you and your family, man. I just can't thank you enough.
Thanks, John.
All right. Well, hey, Dr. Bailey, have a great week. Have a great 4th of July. Thank you so much for coming on our podcast. And, if you need anything at all, just give me a call.
I will. Thanks, Sean.
All right, Dr. Bailey. Thank you so much. All right. Bye-bye.